Now we want to check back when we talk about eye on health. Sleep apnea is a common condition that affects millions of Americans. CPAP is the most common treatment, but it doesn't work for everyone. Latrice Curry has another option in her Eye on Health report.
Most people who suffer from sleep apnea turn to a breathing mask known as CPAP for treatment. But for some, it just doesn't work. Now there's a new form of treatment available to patients in our area. This is Inspire, the latest treatment for sleep apnea. I spoke with local sleep specialist Dr. Anuj Chandra. He says it's like a pacemaker for sleep apnea.
So it's implanted, by an ENT surgeon, and it's a little wire which they attach to the hypoglossal nerve, and they give the patient a remote. And the patient, switches the remote on at night.
The subliminal current goes to the nerve and helps keep the airways open. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts.
With significant links with heart disease, with irregular heart rhythm, with heart attacks, strokes.
Men and those who are obese are most at risk for sleep apnea. Some of the common symptoms are loud, persistent snoring, pauses during breathing with gasping episodes while sleeping, excessive sleepiness during waking hours.
And it's got a huge detriment on the whole body. When you should be actually sleeping and healing, the body's under, it's being damaged.
While this has risk and complications like any other surgical procedure, Dr. Chandra says it's a good option for those whose CPAP don't work.
It's going to save lives and give people another option for treatment.
Latrice Curry with that report. Dr. Chandra says they are working with Memorial Hospital to do the actual procedure here, but it has been delayed because of COVID-19. Right now, pre and post care are available here in Chattanooga, so the patient doesn't have to make multiple trips to Nashville.